First, let's define experiential learning and children with participation restrictions. Experiential learning is the process through which students develop knowledge, skills, and values from direct experience outside traditional academic settings. Children with participation restrictions is defined as a child that has any difficulty with physical or cognitive limitations that affect the course of their daily life. Experiential learning is utilized in PT education programs as a practice-based education which allows students to apply their knowledge and skills to a clinical setting. Experiential learning is utilized in PT education programs as a form of basic education which provides students with opportunities to apply skills and knowledge they have learned in the classroom to a clinical setting. Although the evidence supports experiential learning in PT programs, there are still discrepancies in the type and amount of hours needed. Discrepancies range from 0 to 170 didactic hours, 0 to 126 laboratory hours, and 0 to 70 direct contact hours. The purpose of this study is to investigate an additional 8 experiential learning hours with children with participation restrictions on physical therapy students' perception of comfort with children with participation restrictions and preparedness for pediatric physical therapy practice. Research design consisted of a retrospective study of 3 questionnaires completed by second-year PT students over a 4-year period who participated in intentional experiential learning activities as a component of Lifespan 1 Pediatric Physical Therapy course. There were 167 participants. The actual number of students varied during the analysis as not all students completed all 3 questionnaires given. Participants included second-year PT students from the University of Mary completing the Pediatric Physical Therapy course. 3 questionnaires were given throughout the course. The first questionnaire was given previous to any experiential learning hours with children. The second questionnaire, given at the midpoint, was after experiential learning hours with children without participation restrictions. The third questionnaire was given at the end of the course, following experiential learning hours with children with and without participation restrictions. Students participated in 6 hours of experiential learning with children without participation restrictions and 8 hours with children with participation restrictions. 2016's class did not get the 4 hours of torticollis and plagiocephaly ice as the other cohorts did.
A two-way ANOVA was used to analyze the effect of time, group, and interaction effect on the participants' comfort and preparedness levels. This is basically saying that we're looking at the change in comfort level over time for all participants in the study. We then grouped them into 2 groups, one group being students who plan to specialize or work part-time with pediatrics, and the second group planning to occasionally or never work in pediatrics, and compared the 2 groups' mean comfort scores independent of time. And then the interaction effect was looking at the change in students' comfort level over time in addition to the comfort scores between the 2 groups. We first did a two-way ANOVA to find the change in comfort level in our research participants over time indicated in Table 1. We found that there was a significant change in comfort level over time in all questions asked on the questionnaires with a p-value of less than 0.05. A follow-up paired t-test shown in Table 2 found that the change in comfort level was significant between all questionnaires except between questionnaires 1 and 2 for questions 1, 2, and 3. This is likely explained by PT students, in other words participants, not having any experiential learning with children with participation restrictions at the time questionnaire 2 was administered. Large mean differences were seen in questions 4, 5, and 6 on Table 2 between all 3 questionnaires. This could be explained by the possibility that students were less comfortable evaluating and treating children at the beginning of the course, but with education and experience, their evaluation and treatment skills improved significantly. A second ANOVA was completed to look at the main effective group for each of the 6 questions. We found that there was a main effective group for questions 1, 2, 3, 4, and 6 indicated in Table 3. Table 4 is a follow-up independent t-test that was done to look at the mean difference between the 2 groups in questions 2 and 3, which are our questions of interest. This test indicated that there was significant difference in the mean comfort scores, independent of time, between groups for both questions 2 and 3, with the specialized part-time group having the significantly higher mean comfort level. This could be due to students who plan to work in pediatrics feel more comfortable regardless of the experience they had during this course compared to those that only wanted to occasionally or never work with pediatrics. Table 5 shows the ANOVA results for the significant interaction between group and the size of the change that occurred within each of the groups. There was a significant interaction effect on questions 2 and 3 for both time and group, indicated in Table 5. Question 2 and 3 are followed up with a paired t-test that looked at each group separately on the change in comfort scores over time. It was found that both groups had significant changes in comfort scores from the beginning to the end of the course. The occasional never group indicated in Table 7 had a larger change in comfort level with children with participation restrictions and comfort level with adults with childhood onset disabilities, compared to the specialized part-time group. This may be due to the fact that prior to the pediatric course, they had little to no interest in treating pediatrics, but by the end of the course, they increased their knowledge in working with the pediatric patients, which increased their comfort. This supports the recommendation that experiential learning, whether you are interested in pursuing pediatrics or not, increases PT students' confidence with children with participation restrictions and adults with childhood onset disabilities. In conclusion, the results of this study indicate a significant correlation between the implementation of experiential learning hours with children with and without participation restrictions and PT students' increased levels of perceived comfort and preparedness. Even with a low to medium amount of hours, there is still significance in comfort and preparedness change, which supports the use in all programs with a variety of resources and access.